come to eating disorders. So eating disorders are mainly of four types: anorexia nervosa, bulimia nervosa, binge eating disorder, pica. So let us see one by one. The first one is anorexia nervosa. Actually, here the main thing to remember is the BMI is less than 18.5. Actually, the feature of this disease is the patient is very thin, but still the patient thinks that she is very fat. So this is a kind of disorder mainly seen in female, young female, most common in young women. She feels always she is overweight, but she is very thin. So because of that, she takes lower calories, and that will result in further weight loss and also nutrition deficiency. So this is also present with hypothyroidism and amenorrhea. Amenorrhea means the gonadal axis is disturbed, so that there is no menstrual period, and osteoporosis because of low calories, low calcium, and lanugo, that is hair loss. And there is also sclerosis, that is a dry skin and hypotension, but the cortisol is increased because of increase in anxiety in these patients. So anorexia nervosa is the female is already thin, but she feels she is overweight, so she loses lot of calories. So this is psychotic problem. So here the BMI is very important, and pancytopenia, that is all the blood cells are also decreased. So it is again divided into three types, that is binge eating or purging type. That is, this female only, she's very thin, but she eats lot. Binge means unnecessary eating, so she eats unnecessarily. And purge means she'll vomit out again, so that she feels okay, now I'll be thin, I'll not become fat by eating over food. Okay, restricting time, she restricts herself, like she does diet fasting, and also she does more exercise, so that she thinks she can become thin. And refeeding syndrome is as someone like she's malnourished patient, and now she suddenly starts eating a lot of food, then that will lead to rise in insulin suddenly. That will lead to decrease phosphate levels, decrease potassium, decrease magnesium, and that will lead to cardiac complications, rhabdomyolysis, seizure. So this is very severe problem, leading to sometimes death also. So refeeding syndrome is very dangerous, that someone is fasting, malnourished, and suddenly eats a lot of food, rise in insulin, leading to phosphate decrease. Phosphate hypophosphatemia is a main feature leading to cardiac complication. So treatment for this kind of disorder is nutritional rehabilitation, psychotherapy, also olanzapine. Next, coming to bulimia nervosa, and one more thing, anorexia nervosa, you can say it will last for 3 months. So timelines are important as usual. Anorexia nervosa for 3 months. Anorexia means already thin but feeling fat. Bulimia nervosa means recurring episodes of binge eating. She eats unnecessarily lot of food. So to compensate that, she uses her hands to purge, to vomit out. So that will lead to Russell sign. Like on the knuckles, you can see they are destroyed because she tries to vomit. And Mallory Weiss syndrome, that is tearing of esophagus because of continuous forceful vomiting. Enamel will get erodes because acid is coming into the mouth, and also parotid gland will get hypertrophy because she's continuously trying to vomit. The acid, stomach acid, will goes into parotid gland, and that will become hypertrophy. So how to differentiate bulimia nervosa from anorexia nervosa is, in bulimia nervosa the BMI is normal or slightly overweight, slightly it will rise, but the BMI is normal. That is how you differentiate bulimia nervosa from anorexia. Anorexia BMI is low, this is very important. In bulimia it is not. So you can also see here like metabolic electrolyte disturbances, like decreased potassium, decreased chloride is very important, because whenever you vomit there will be decrease in chloride less than 20. There's also metabolic alkalosis, dorsal hand callusis, because of inducing vomiting, that is Russell's sign. So these are very important signs which you see: parotid gland hypertrophy, enamel erosion, Mallory Weiss syndrome, electrolyte disturbances, and Russell's sign. So treatment is again psychotherapy. Antidepressants, again SSRIs. Bupropion is contraindicated, very important. Bupropion is contraindicated here because there is a risk of seizures. Okay, next, binge eating disorder. This is also for 3 months. Binge means, I already said, unnecessarily eating lot of food, and here this will also last for 3 months, as here she's not doing any compensation, she's eating, so that will lead to rise in diabetes risk. And this is most common eating disorder you can find in adults. Treatment is important treatment, list dexamphetamine. which is an ADHD stimulant, and also of course SSRIs are first line. You can also give psychotherapy. Next, coming to pica. Pica is like eating something which we should not eat. Like for example, hair, eating air, ice, chalk pieces, paint, pins, chips, all these things. So eating abnormal food is pica. This is because they get some emotional relief from that. You can see this in children and also during pregnancy. And this is also associated with some malnutrition, iron deficiency, anemia, developmental disabilities, and some emotional trauma. These kind of people do this thing. Treatment is psychotherapy, nutritional rehabilitation, SSRIs. Here also remember timeline. Pica greater than 1 month. So all these are three eating main eating disorders: bulimia nervosa, anorexia nervosa, binge eating. All are 3 months. Only pica it is special. So remember greater than 1 month as it's special number one, special one. Okay, all those are three. So main thing is you need to able to differentiate them. Now coming to gender dysphoria. Gender dysphoria is in birth time you give some gender, like when you are birth you say she's female child, but as they grow into elder, like in their puberty time, they are like male. So this is gender dysphoria. At birth they are child, but when they are adult they are male. So this kind of problem lies for 6 months, you can see here. So this will lead to some social, economical, and it will lead to some distress, right? Because in gender they are female, now they are male, means it is very distressing for them. So socially, legally, medically, it is very distressing for them. Next, understand transgender is an individual who experience incongruence between gender identity and gender assigned at birth. So these individuals who are transgender will experience gender dysphoria and then non-conformity to one's assigned gender. It's not a mental disorder, that is important. Remember that. Transgender is not a mental disorder, but gender dysphoria is a mental disorder because they feel bad when they are diagnosed, like they're known as child, a girl child when they're born, and now they're male, or vice versa. They are known as male when they're born and now they're female. They feel very distressed in many domains. So this is also for 6 months. Gender dysphoria is for 6 months. Eating disorders all for 3 months. Pica 1 month. Okay. Next, sexual dysfunction is like they include sexual desire disorders like hypoactive sexual desire, or sexual arousal disorders like erectile dysfunction, organism disorder like anorgasm, premature ejaculation, sexual pain disorders like genitopelvic pain, penetration. All these are involved in this sexual dysfunction. So they are differentiated from penis. What is penis is a mnemonic for this. P for psychological, like if nighttime erections will occur. Endocrine, like diabetes, low testosterone. Neurogenic, post-operative, spinal cord injury. Insufficient blood flow, atherosclerosis. Substances like antihypertensives, antidepressants, ethanol. Now let us come to sleep physiology. So sleep physiology is when you are awake and your eyes are open. So you're not sleeping, but your eyes are also open, like normal position, daily life normal position. In EEG, if you track that, you'll have beta waves. That is decrease amplitude, increase frequency. How you remember this is if you open your eyes, you have more frequency, like that I remember. Okay, awake eyes and close. I mean, you are awake, you're still not sleeping, but your eyes are closed, just like your meditation example. That time you have alpha waves. So remember, in meditation, you have alpha waves. Here you have more amplitude, alpha for amplitude, A for A, decreased frequency, okay, and it is more synchronous. So, first, when you are awake, in both cases you are awake, first time just normally you are opening eyes, more frequency, that is beta wave. Next time you are closing your eyes like meditation, alpha waves, but still awake. So this is high amplitude. Next, coming to non-REM sleep. So you know sleep is divided into non-REM and REM. So non-REM sleep is again divided into three types: N1, N2, N3. N1 is the A waves, like you have light sleep. Sorry, they have theta waves. You have light sleep. So how to remember this in order? Actually, alpha, beta, theta, like that we can say. But here reverse, first beta, alpha, theta. Okay, theta waves, light sleep N1. N2 also theta waves. You have K complexes, more amplitude, and you have sleep spindles. So K complexes, sleep spindles are specialty for N2. Here also more frequency, and 50% of the largest sleep time you spend here in N2 And this is also having teeth grinding, that is called bruxism. You grind your teeth in your sleep, that is in N2. Most of the time you spend in N2. Next, coming to N3, it is the last phase of non-REM sleep. Here you have delta waves. So beta, alpha, theta, delta. Okay, delta in N3. Here you have slow waves. And the deepest sleep is where you have sleepwalk, talk, sleep talks, bedwetting. All these are in N3 because this is the deepest sleep. Non-REM N1, N2, N3, N2 specific for K spindles, K complexes, spindle fibers, theta waves. N3 for delta waves. Here this is a deeper sleep, sleepwalk, talk, bedwetting. Okay, very important. And N2 also remember bruxism. 50% of the sleep also N2. Now coming to REM sleep. REM sleep is rapid eye movement sleep. There PPRF is involved. Here it is low voltage, saw-toothed waves. You see saw-toothed wave. Loss of motor tone, dream, nightmare. So dreams, nightmare all occur in REM sleep. So it is more deeper sleep when compared with N3. So sleep cycle is from NREM to REM, NREM to REM like this. So for one NREM to REM it takes 90 minutes. So like this there are many cycles going on throughout the night. So the length of REM increases during cycle whereas N3 length decreases. Actually, if you see in hypnogram, if possible, you check out in Google and hypnogram. If you see the hypnogram, you'll understand that as this sleep cycle is going on, REM sleep will increase but the N3 will decrease. What is parasomnia? It is occurring in sleep. Undesirable events, unwanted experiences are parasomnias. It is REM related. There you have sleep paralysis, that is you are awake but you can't move. So it's a very terrible situation. Sometimes you sleep on the bed, but you know you are awake everything, but you want to move your leg, hand, but you're not moving. That is sleep paralysis, which is a parasomnia of REM type. Okay, and nightmare disorders, all this also occur in REM. In non-REM related, it is N3, you know, deep sleep, walk, eat in the sleep, do scream in the sleep. All these are non-REM related N3 parasomnias. Okay, so this is about sleep physiology. Now let us discuss about sleep terror disorder. In the name itself you can see something like terror. So it is a nightmare or something screaming. Children will scream in the night, especially in N3, non-REM sleep, very deep sleep. Even in REM sleep it can occur, but remember in REM sleep you will remember, but in non-REM sleep the child is unconscious and she suddenly screams in the night. That is non-REM N3 phase. But in REM sleep she can remember. That is the child wakes up and say, last night I got a scary dream, nightmare. So that is in REM sleep. So these are terror, sleep terror occur in NREM and REM. Enuresis. Enuresis is for 3 months. Enuresis means bedwetting, which usually child do. Even an adult can do. If you remember ego defenses in regression, if there are some stressful situation, then even again an adult can go into childhood and they can do this bedwetting time. So enuresis is for 3 months. Night time urinary continence greater than 2 times per week or 3 months in person greater than 5 years old. The main treatment is behavior modification and positive reinforcements is necessary, or you can use bedwetting alarm, oral desmopressin because it is anti-diuretic, right? And preferred over imipramine. ADHS analog is more preferred than imipramine due to fewer side effects. Next, coming to narcolepsy. Narcolepsy is like the person is sleeping in the morning time and it is associated with HLA DQB1. Okay, actually here there is more sleepiness greater than 3 times per peak for 3 months. This is also for 3 months. A patient is sleeping more in the daytime because of decrease in orexin, that is also called hypocretin 1. So this is actually produced in lateral hypothalamus, and dysregulated sleep wake cycles also seen because they're sleeping more in the morning. So this is associated with hypnagogic, hypnopompic. Hypnagogic means when you're going to sleep. Hypnopompic means when you are awakening from the sleep. Like these hallucinations you can see in these people. And narcoleptic sleep episodes, nocturnal and narcoleptic sleep episodes start with REM sleep, that is sleep paralysis is also seen here. Cataplexy is loss of muscle tone after strong emotional stimulus like laughter. All this are seen. So very important. Cataplexy, sleep paralysis are associated with this, and for diagnosis you usually test the CSF. Okay, and hypnagogic is most common. Remember, treatment is good sleep hygiene. Okay, and daytime stimulants like amphetamines, modafinil is used. And also sodium oxybate can be used. Okay, Sometimes you can also get autoimmune narcolepsy, where orexin is killed because of autoimmune process. Okay. Next, coming to substance use disorder. You can know because of using some abusive substances, there is a disorder which is for 12 months, like for an year. So there is tolerance, withdrawal, intense destructive cravings, more longer, and persistent desire, but unable to cut down. For example, you take alcohol, they are so much addicted, they can't cut it down. They are time consuming and impaired functioning at school, homework, social interpersonal conflicts, reduced recreation activities. So it is also danger, and it is continued use despite awareness of harm. They know that it is harmful, but still they use. So medical treatment is very important. Next, coming to gambling disorder. Gambling, in the name itself, you can see they are like, you can diagnose them if any of the four are present. You can see here, preoccupied with gambling, requires more gambling to reach desired level. Like if they're addicted even to gambling, they do more gambling, and if they failed efforts, they cut back again, stop gambling. Becomes restless or irritable when limiting to stop. Gambles to escape or relieve feeling of helplessness, guilt, anxiety. After losing money gambling, again they continue so that they think they may recover that money lost, and they lie to conceal the extent, put a risk loss of relationship, career, academic pursuit, relies on money from others, okay, to fix that lost financial collapse. So treatment is psychotherapy. So this is like very wrong ideas if someone are going to this kind of gamblings. So they are stuck in that circle and they are continuously doing gambling. Now let us see trans theoretical model of change. This is very important topic. Actually, it is divided into pre-contemplation, contemplation, preparation, action, maintenance, relapse. Actually, this is a motivation therapy which is given for alcoholics or some drug users. So pre-contemplation is first they'll explain the problem and they'll deny the problem and its a consequences. Like for example, if you use alcohol, you'll get this kind of disease, your liver damage. Then they first deny. That is called pre-contemplation. Next, contemplation is they can understand the problem. Yes, because of this, I'm getting this problem, but they're still unwilling to change. That is called contemplation. Next, preparation is yes, they are determined. Now they are ready to leave that, and they're planning for the change. And action or willpower is like they execute a plan and demonstrate change. So they are still planning, and also they are like planning to change. That is action. Maintenance is now they have changed completely, so the new behaviors sustain, they integrate into identity and lifestyle. Like now they are changed to this behavior. But sometimes if any like they have done all this, but again if their addiction is more severe, then they may also have, then they can also have relapse, which is very bad thing, because they have done this with lot of motivation, determination. Now again they went back. This is very bad. So regression to prior behavior does not always occur, but not always occurs, sometimes it may. So these are the stages: pre-contemplation, contemplation, preparation, action, maintenance, relapse. So by this we completed part 3.